Good morning, everyone. This is Dr. No, Kid Focus Dentistry. We are making a really informative video today regarding to help young mothers or expecting mothers. This is actually one of our #1 request video because every time I see new patient, new parent, after I talk to them, they all was telling me how much they wish this information would be available to their friends and family. So first of all, congratulations on your new little ones coming, and I hope this information will really help you guys get a head start in not only helping your child but helping you through the journey of being a new mother. Alright, so my #1 advice for a young mother or mother-to-be is really to take care of yourself. So studies have shown that the bacteria toxins that was released from gingivitis or gum disease can affect your newborn birth weight, and also it can cause premature birth. So it's really important you find out that you are pregnant to have a good home dental care, someone that you can go to regularly, so then you are healthier yourself. A lot of parents ask me this all the time. Is cavity genetic? Because parents, they themselves had a lot of dental work and they really worry about passing that on to their newborn. And the answer to that is actually a really complex answer. It's not a clear cut of yes and no. It really is a combination. So first of all, we need to understand that infants are born without bacteria that cause cavities. So how we are getting that cavity is through sharing food and utensil, or even when the pacifier dropped on the ground, what happened is you put it in your mouth, you clean it out, and you give it to your child. Well, in that process of sharing these spits, what you do is you transfer this bacteria to your newborn. So let's say if you are someone that already had a lot of dental work, what that means is that you have higher bacteria counts. So then therefore, when you have high bacteria counts and you transferring this to your child, it will make your child have higher bacteria count, and therefore they will be more prone to cavities. So in a weird way that is genetic, is because we as parents inadvertently always somehow wanting to share things with a child rather than feeding your child to something like a spoon. So try to limit that, and that will really help. Same thing if you have multiple children and they had a lot of dental work. Try to prevent them from sharing food and utensil as much as possible. The other component to the genetic term is that how your child learning to eat is really through you as a parent. So here at Kid Focus Dentistry, really focus on making sure that we pass on the information to parents about a healthy diet style. What do I mean by that? So first of all, what we don't want is we don't want grazing. Okay, why is that bad? Because any time that you put food in your mouth that other than water, and mostly carbs, what happens is the mouth is going to turn acidic, whether through the food itself or through the digestion process. So if you graze all the time, your mouth is always staying acidic. So then therefore, it will start breaking down, preparing the tooth to get in cavities a lot easier. Okay, and the second thing is the same thing if your child is a food hoarder, like the chipmunk phase, where they're holding food in their mouth for a long period of time. Again, that will cause acidity too. So I think most kids, the grazing part is what we really have problem with, and that's including drinks, that's not water. So if you are getting good about your own habit, and especially, I understand when you're being pregnant, you want to eat a lot more often, and we're not against snacking, we just want to make sure we like about an hour in between food to allow your mouth to kind of neutralize the acid. And as your child getting older, you want to do that and try to stretch out that in-between time as much as possible, so then therefore the mouth has an ability to neutralize the acid. Alright, so hopefully that will kind of help you kind of understand the genetic side of cavities on there. I mean, there's always a rare case where it is the kid's saliva is not doing well, but that is so rare and few in between. We want to really hit on the main point why we see a lot of these young children developing cavities on there. We're gonna move on to the next thing, where I'm sure as a going to be new mother, you guys are thinking about breastfeeding, and I highly encourage it. And we all know the study of how it's great for the bonding, is great for the child and the mother, mental stability, mental health, but it's also really important for your child's growth and development. So we take for granted that when you're born, you know how to swallow, and you think that's just something that comes as human nature. But actually, the habit of swallowing correctly, whereas promote correct growth, is actually through breastfeeding. So this is another really big reason why we highly encourage, if at all possibility, even if you can only do it in a short amount of time, because I know a lot of our mothers working, if you can do as much breastfeeding as possible, this will help your child to swallow correctly. So versus something like a bottle. So we talk about feeding, bottle versus breastfeeding is two completely different patterns. So when you are doing breastfeeding, the way that you milk the milk out of the mother breast is actually promote the pattern of how you should do a correct swallow. So when they are trying to milk and swallow at the same time, the tongue is actually going to a wave. So it's going to go up to the roof of the mouth and then it roll back down. The fluid is going to go to the throat. Versus something that is bottle fed, which is what we call a piston motion. It's going to go forward, just pressing forward, and then they swallow. So then therefore, that's what a lot of time in myofunctional therapy, we use the term reverse swallow. All it means is an incorrect pattern of swallowing that does not promote healthy growth. So if you can, at all possibility, try to breastfeed as much as you can, because that will teach your child to swallow correctly to promote the correct growth that we are hoping for. And a lot of time that can help prevent braces or speech problem. So looking at that is another great reason why, if you can, go ahead and breastfeed. As a mom, I remember when I started breastfeeding, I really wanted to breastfeed. And this was a while ago. I had a really difficult time breastfeeding, and we looked for the tongue tie and the lip tie, and it was good. And then I found out later on that my child, both my children have buccal ties. So it's really important that if you have difficulty of breastfeeding, please find someone that will help you diagnose the reason why you're having difficulty with breastfeeding. Again, breastfeeding is a really complex process that doesn't seem that complex, but if you have someone that understands about this, like a nurse practitioner, they will help you along your journey, so it won't be so frustrating. And the sooner you can do it, the much easier it is for you through the journey. Okay, so we are going to kind of break it down to why there's these ties in your newborn oral environment that can cause difficulties with breastfeeding. Again, it's a complex process, so this could be a part of the problem. It's not, doesn't mean this is the only problem, but hopefully maybe if you guys can see the same pattern, when you have difficulties, you can understand, and hopefully you can find someone to help you diagnose this. So the first thing is the tongue tie. So a lot of expecting mother or new mother have heard of this term before. So what tongue tie is this little soft tissues that hold your tongue to the bottom of the floor of the mouth. And on most kids it's okay and still allow them a good range of motion. Some kids it's just tied so far down that this range of motion is not, the tongue is not being able to move in a way that it needs to be. So then therefore the child cannot latch as well. So usually when you have latching problems that tend to be tongue-tied issues, especially if your child is one of those kids that they cannot self-soothe and needing a pacifier all the time. This is a lot of time, one of those kids that you see even in utero sucking on their thumb. A lot of time what it means is they don't know how to self-soothe because their tongue cannot go up to the roof of the mouth to self-soothe. So then therefore they need a pacifier or thumb sucking to kind of help them with the self-soothe. So again, that's something that we want the nurse practitioner or your pediatrician to start looking at that, and that's usually the main reason why a lot of the kids cannot latch onto the breast. The second thing is the lip tie. So lip tie is the soft tissues that tying the lips to in between the two front teeth. Again, some form of tie is normal. Severe tie can cause difficulty with seal onto the breast. So if you're one of those mother that have to use a nipple shield in order for your child to get that nice seal for suction, that could be a problem, is the lip tie. So have someone take a look at that if that's your problem. And the last of the tie is what we call buckle tie. This is actually something a lot newer. Not a nurse practitioner or a physician knows about, but this was what I experienced myself. If your child is latching on well, if they have a good seal, but you are in so much pain breastfeeding your child because after a while your nipple is super chapped and bleeding, have them check for a buckle tie. What a buckle tie is, these are the soft tissues that tie, but instead of in the front or underneath the tongue, it's on the side. What it does is it activates the cheek muscle where it's not supposed to activate. So they sucking too strongly. So by sucking too strongly, they can't milk you properly. So you tend to have low breast milk production, and then very painful feeding. So again, that is the other one that someone can help you to look into that. If your physician is not really aware of these ties, or if your nurse practitioner is not very aware of that, I would highly recommend, there's a website called Colorado Breastfeeding Coalitions. That's a great website for you guys to get resources into finding out someone that can help you with that. And hopefully that will help. Again, this is not a full-on diagnosis of what you have. This is just from a dental side, we see these ties and what we see that affecting the newborn from being able to do the breastfeeding for you. Okay. Next thing is this is something that is really dear to my heart, and this is one of those messages that I don't think is really been talked about a lot. We want to talk about the use of pacifier. I know that the moment that you're leaving the hospital, they give the child a pacifier, and I understand the science behind it because there's a few kids, again, those ones that have very severe tie, they do need a pacifier to help self-soothe. But if you think about it, pacifier is really a modern technology. We really haven't always have pacifier, and we don't need as human beings need the pacifier. The reason why I am against the pacifier is it's really taking away your child's ability to self-soothe. And why is that important? So when your child is have a pacifier, there is this chemical, oxytocin, is released, and this is actually anytime you put pressure on the roof of the mouth, there's a chemical, oxytocin, is released, and it's a soothing chemical. As human beings, anatomy-wise, the reason why that is created is because the body wants to encourage the tongue to go onto the roof of the mouth. This is everything. This is really helping your child to developing a capability to self-soothe, capability to grow correctly. So we really want your child to be able to do that. But if you start introducing the thumb or the pacifiers, what happens is it's creating even more pressure than a normal tongue on the roof of the mouth. So then therefore this higher dose of oxytocin, so then therefore the child becomes really addicted to this needs of having an external source to self-soothe. So if at all possible, you guys can either limit or not even introduce the pacifier to your child life. And even if you have a pacifier, we highly recommend to break the habit by the 5th month. There should be no need for a pacifier after 5 months on there. And we'll go into, we'll make a video that will go into in depth of how to do these kind of habit breaking on there. But we really want you to be aware of the detrimental problem that a pacifier can cause. It really interferes with a lot of growth, a lot of speech problem, and it's something like that seems very simple, but it plays a huge detrimental effect on your child growth and development. And most parents will come to us most of the time by the age of 1. However, we have kids that come to us by the age of 3 or 4, and it always breaks my heart when these kids come in with a lot of cavities, and cavities is completely preventable, and it's all about us giving you the right information and for you to know and apply it to daily life. So I highly encourage for you to find a dental home for your child at First Tooth. So the American Dental Academy, we highly recommend First Tooth First Dental visit. The reason why is it is important for you, and it's so much easier to create good habits rather than try to break bad one. And for us to give you the right information, so then therefore you don't have to deal with consequences of cavities at such a young age, because the limitation that what we can do to treat these cavities is very limited, and we rather prevent cavities rather than try to fix the cavities on there. So hopefully you guys will find this video helpful, and if you have any questions, just give our office a call at 303-543-8338. And even if you guys are not our current patients, we definitely would love to help in any kind of question that you have, and also check out our website. We have a lot of great information, and also check out our YouTube video. Thank you so much and have a great day.